we're gonna be doing today. The procedure that we're doing today is gonna be a PRP Microneedling procedure. Basically, it's a fancy word for a minimally invasive surgery to improve the texture of the skin. So PRP Microneedling is something that's kind of getting real big in cosmetics, mainly because it's a minimally invasive surgery. And what does minimally invasive mean? It just means that it's a shorter recovery period, less complications, and the overall treatment itself is pretty straightforward and it's usually safe. So PRP stands for Platelet-Rich Plasma. What that is a component of your blood. So we remove a little bit of the patient's blood, we spin it in a centrifuge, and we get the growth factors, we get proteins out of the blood, and that is going to help with improving the skin quality. So microneedling, if you look at this little plastic instrument, it's a small opening at the end with very small needles in there, and we use this device basically to make small holes into the skin, and then we will use the PRP to place over those small holes that we just made in the skin, and that'll help with just improving the overall skin texture, quality. You can even treat hyperpigmentation, which if you look at somebody, you see like dark spots over their face, that's hyperpigmentation, so that can be a good treatment for that. Even acne scars, so if you see people with small divots or scarring, discoloring from acne bumps, that can be treated with this as well. What else? You can even use microneedling for hair rejuvenation too. So basically, if you get thin areas in the hair, a lot of times with black people, especially black males, will get thin in our corners, or you'll see in the front lineup, if your lineup is kind of fading away, there's a good treatment for that as well. So a little bit about PRP microneedling.
Let's look.
Thank you for being here today. Thanks for showing up. You nervous? It's just okay to be nervous. So today, what can we do for you today? What are your concerns?
So I want to know just again the benefits of the microneedling, what I can expect after the process is done. What does the healing look like, and what are the benefits?
That's a good question. So microneedling in general. The biggest thing with microneedling, I guess, it's become very popular because it's a minimally invasive procedure. Okay. And when we talk about minimally invasive, we usually talk about what kind of categorizes minimally invasive versus true surgery. So minimally invasive, the recovery time is usually pretty quick. And then when we say quick, we usually say around 3 to 5 days. Okay. So the recovery period is around 3 to 5 days. The expected things that you can most commonly see, you're gonna be swelling and some redness, right? And we say redness for fair skin people. You may have a little bit of, depending on how you bruise, redness or dark discoloration in the areas. Typically, again, may have, I guess, pain, stinging from the areas because the microneedling is actually a series of small needles that we use to basically make small holes into the skin, right? And so what that does is it starts the inflammatory process, and it's very fancy, but basically by making small injuries in the skin, it's going to activate your body's healing response. And so by doing that, the skin is going to tighten itself, and so that produces a better skin texture. It can also treat it can treat hyperpigmentation. So if you see discolorations in your face, if you ever have scarring from acne, definitely improve that. A lot of the things that people tend to notice is more so, it's more so subjective, right? So I say that to say your skin more than anybody else's because you look at it every day in the mirror, right? You'll be able to see more changes than somebody else, I'm gonna be honest with you. So it's a very, say you get 2 to 3 to 5% increase in your, or improvement in your skin texture. If you're looking for something a little bit more drastic, right, that's more so gonna be taken care of with radio frequency. And the main difference between radio frequency and microneedling is the use of heat. So radio frequency has the same type of small needles, but there's an electric current going through there, so that heat is going to go into your skin and then also increase the tightness, so you get a little bit better results. It'll be 3 to 5 days.
How do I treat my skin? Am I still using my same products every day?
That's So you want to avoid anything that's super abrasive. So like doing facial cleansers or exfoliants, you probably want to stay away from that stuff for the next 3 to 5 days. Gentle cleansers or anything like that's going to exfoliate the skin, you want to stay away from that because that's going to increase the injury to the skin as well. So cleansers without exfoliants are okay. And then your day-to-day.
I use like vitamin C serum.
No, that's okay. Actually, some treatments actually will combine vitamin C or retinol with microneedling. Same thing with exosomes. You can combine exosome treatment with microneedling. And in your case today, we're going to be combining PRP microneedling.
Can you tell me exactly what that is?
Absolutely. So PRP is short for platelet-rich plasma. So what we do, we take a small sample of your blood, probably around a small tube, right? And we place that tube into a centrifuge. A centrifuge is a machine that spins around very fast. So by spinning the blood in that test tube, it's going to separate the platelets from the red blood cells. So there's 2 components of your blood. We want the platelets, right? So there's going to be 2 different layers. The plasma, which is going to be yellowish color, is going to be at the top, and then at the bottom is going to be red. So at the bottom, that's where the red blood cells are, and at the top, that's where your that's where your plasma is. So within the plasma, your platelets have growth factors in them, they have stem cells in them, they also have proteins inside your platelets. So what we're gonna do is we're gonna be taking the growth factors and the proteins from your platelets, and we're going to then inject those into the small areas that we use and we created with the microneedling. So basically, long story short, we have growth factors from your platelets that are going to help tighten your skin. They're going to help activate collagen in your skin, and that is all thought to improve the texture of your skin. So those are all good, great questions actually. And because this is your own body, it's your own blood, you might have to worry about having foreign reactions or anything from like foreign substance, right? So a holistic treatment, that's usually why people like to PRP versus doing exosome or a stem cell from another animal or somebody else's body. So
that makes sense. How long does the procedure take?
So the procedure itself probably takes around 30 minutes, right? But we also want to make sure that you're comfortable. So we'll have some numbing medication, plus a topical numbing medication that we put on there. Usually around 15 to 20 minutes. We'll let that sit. We'll let you get comfortable. We'll clean your skin off. We'll take off the numbing medication. And then we'll start the microneedling. We'll get the PRP on there, and then you'll be all done.
Perfect.
So about an hour.
How long does it take for the numbing to wear off?
For it to wear off, it's going to be probably another hour.
After the surgery, as long as it's not during the procedure, we're good.
And if you do, that's a good question too. So if you feel anything as far as discomfort or pain during the procedure, just let me know. I can get you some more numbing medications.
How would you rate the pain level on a scale of 1 to 10?
3 to 5.
Okay, I have a low pain tolerance, so that's good.
Take care of you for sure. How good?
Sounds good. I'm excited for this treatment.
So that's a good question. So you could have any active infection, any active swelling of the skin, any acne. At that point, if you have any open wounds, you wouldn't want to do anything right now, just because we would cause more harm than right. So
it could like spread and stuff. Right?
Exactly right. Or if you had a history of herpes outbreak actively going through that, we won't want to do that at that time either.
So those are the only contraindications. You see enough?
Sound good?
Sounds good.
The assistant's here, and I'm going to take some blood from you. Do you have a preference here?
I don't have a preference.
Oh,
You see them both?
I'll look at. I see this one.
Okay.
I like that. I see it before I do it. And it's just one tube, so it'll be clear.
Okay. You can start doing the smooth.
Right. I don't need to be too tough.
Like this.
Sorry.
We got going.
Got some PRP microneedling going on today. We're gonna get somebody right. So we're gonna get some improved skin texture, quality, treatment for hyperpigmentation as well, and acne scarring.
Sure, tell them what separates your services for everybody else that's doing the same services.
Man, what's gonna separate you, or what's gonna separate myself from,
everybody else?
So what's gonna separate my services from everybody else in the industry is really myself. I'm gonna give you 100%. It's gonna be a great treatment from start to finish. We're gonna treat you like family in here, right? So we talk to you like you're a person, not just a patient. We don't talk over your head. We talk to you exactly where you are. We're gonna meet you where you are, whatever your expectations are. We'll make sure we're a good fit for you, and we gotta get some producible outcomes. So good outcomes, good people. We're gonna take care of you, treat you right. You don't want to numb your face for a facial balancing, because if I numb you before, it's basically like introducing a needle, right? So it's gonna swell it a little bit by getting you numb. You know what I'm saying? Because I have to put the numbing injection or the numbing medication under your skin. So then to make sure that we get the results that we want, I'll then have to go back in with the filler after that. You know what I'm saying? So it's recommended not to numb the patient before and then just use the filler, because it has numbing medication in it. So usually the first couple of injections is gonna hurt the most, and then once the numbing medication is working, does that make sense? So it's basically like getting extra injections before you actually get injections.
Right.
This is just alcohol swab, just to make sure we get a good, clean patient, you know what I'm saying? You got another alcohol swab. SPF, you want a cleanser, and then maybe just like or do a retinol, like a vitamin C, don't you?
I do vitamin C, not retinol. I could do better with my SPF. I have one, but I don't use it every day.
I think most black folk know. The thought is that with us being like SPF, but we actually do.
Was this the numbing cream?
Yeah,
They feel the
I
same?
do the same thing, but it's like you asked, like, what about the injection?
Do I need to move my hair back or something?
Oh,
I don't think y'all gonna know what to look for.
The most sensitive part for you is really gonna be like your eyes and right mouth. So
That's fine.
that skin is very thin usually. Forehead is at least.
Easy. Then I do have an off-topic question for you. Whenever I don't know if you, my eyelid, I think it's the right one that you're looking at. Can you see the texture?
Right here on that.
I don't know what caused that. That happened 2 months ago.
Do you have like dryness in the area too?
I never did, but that could have been. My T-zone is very dry. All my eyebrows up through my T-zone area. My forehead is very, very dry. That skin.
Do you have allergies?
Seasonal, only in the springtime. So not really. I don't know what caused it. It looked better. It was worse, but
You keep it moisturized?
I try to. I just use our vitamin C stuff on it.
Yeah, so what we'll do, so we have a few different needle types for you. So what we usually do is we start out with the needle tip with 36 needles in it, and then we'll gradually decrease and we'll 12.
Okay.
And separate it and put this insulin syringes.
I feel your fingers. You said like take 15 minutes, right? It just ain't cute. But I saw a video where a girl did this with no numbing cream. I was like,
So it's
what?
probably the same thing for like dental treatment. People will literally be like, oh, I don't want numbing medication. Man, nobody, you can do that. I wouldn't recommend it. You know,
She just said she was in a rush, so she had to go, so she did it without it. She didn't record the process though, but she was just talking about it.
you literally gonna feel everything the entire time, so it's gonna be uncomfortable.
I don't want to feel it. This is possible. Process, I'll be honest, I said it was trial and error, but we got it right over time. So the first thing is our calls are recorded, right? So when we it's all about it's going to be different because our front desk is exactly our business, right? Their phone etiquette.
It's the same way with dentistry too, right?
So we train them to the T, and we listen to calls. My store managers are listening to calls every day to make sure that they're providing this customer service. If somebody called, asks questions, you don't just bye. You act more open-ended questions and try to figure out what their need is, and you figure it out and book them
Basically
something
kind of
before they
probing a little.
You gotta get we're in business, we need business, so you don't get off a call without booking an appointment or getting them in. That's the first thing is the front, making sure that they're knowledgeable and that they are trained to. When people call, when you get the business, because you gotta.
That's the patient's first experience with the office, right?
Exactly. And it says a lot about the doctor and the service and the experience. It doesn't really, but it kind of does in their eyes. So that's the first part is that, and more than anything, you're going to be used Groupon, making sure that as soon as they call and they inquire about Groupon, even if they say they got one, most of the time they haven't even purchased it yet. They're just looking on the website they're about to. So just have you already purchased it? There's no need to purchase it. We'll honor the rate, all that good stuff. But that's the first part. It's just the front desk. I don't know if y'all can listen to calls and record them, but do y'all do that? they're not recorded. But just making sure the front desk, y'all on the same page is gonna be the biggest part with that. To be honest.
He was trying to figure out how to maximize everybody's work ethic and synergy. They work with other people. And he said some of the issues that they were having was they were assigning tasks to people and it wasn't their strength, right? So you gotta know everybody's strength in the office and then like allow them to use that strength and everybody else should know it too. So basically what he did, he made baseball cards for all of his employees. And so basically it had on their baseball cards what they were good at, like strength, their attributes, right? And at first people were like, oh, this is not gonna work, and they were like hesitant to even do that. But then what they started noticing was like people got more comfortable with their strengths. They were able to identify it in the office. So people embraced their roles more, and then also it was almost like productivity increase. We're only gonna get the people who are good at these things to do those tasks in the office. You're not gonna ask somebody who's not. Don't ask somebody who's an introvert who works good in isolation to do that type of stuff. All right, I thought that was a good idea. Did I master microneedling with PRP? I actually started this on myself. I started treating my hairline, and then a few of my colleagues that I was working with at the hospital after clinic, we would just do it probably every 3 months. And basically it's almost like shooting in the gym, right? It's like practicing. I practice on myself before I ever did this for somebody else or another patient. So I had to understand the overall process, the technique, what to do, what not to do, what areas work well with PRP microneedling on myself before I treat a patient. So just get a whole bunch of data, figure it out. It's all experience. You learn from experience. Experience, what is it? What's it saying? Experience gonna be your greatest teacher. Sure. That's it. Trial and error.
Tell them about being comfortable in the office. What's about your shit?
You gotta be comfortable in your office for sure. They be saying, look good, you feel good, you play good. If you play good, they pay good. So it's just all about how you feel, how you present yourself every day. You show up, feel good, you treat the patients well. So that's what I try to do.
She's scared.
I'm not scared, but she was taking it off and I felt everything. Which I'm a G, so I'm gonna be good regardless.
I'm not trying to torture you.
What?
Hit her with the needle.
The only thing that I feel is my upper lip. I feel that. That's tingly, so I know it's working right there. She's mostly on this side, so that would be the strongest. So would that be why?
So sometimes your lower face is gonna look longer or it's gonna look wider on one side, and that's naturally true on one side too. So this right hand and the left hand is right. Naturally, one of your side of your body is stronger than the other side because that's just from you using it. You're dominant on that side. But again, most of the stuff is like you notice it too because you look at your face every day in the mirror, right? Things that other people may look at you and not even realize that. So at the end of the day, that's really the biggest thing with cosmetics and aesthetics. Is really
just making sure I'm happy.
Exactly.
I mean, it's for me, not really for everybody else.
Exactly. You see on social media all the time where people be like, "Oh, the before look better," or they have comments on the stuff, but I can't tell the difference. Some of the stuff is not really for other people to notice. It's really about how do you feel about the treatment? How do you feel about the results? And that's why it's so important during the consultation to talk about it, to ask questions, to figure out if your provider is able to produce what you're looking for, right? It has to be a good match because you may be looking for something and the provider is trying to give you something else. And if you're not on the same page, ultimately you're not a good team and it's not going to fit. You're going to be upset with the results because you all were never on the same page from to begin with. So
that makes a lot of sense. Well, I think we're on the same page.
I think we're on the same page for sure.
The texture. My esthetician was like, why are you messing with your face? She's like, your skin is perfect. And I'm like, no, it's good. I'm not. I feel like the texture could be better though. My mom and my grandma have like really big texture skin. Oh my God, their skin is so perfect and even. I said, I was like,
look. How we feeling? How we feeling?
For the numbing.
For the numbing working. Be honest.
5.
What you nervous about?
The pain level, but I feel the numbing working, so I think that'll be fine. That's really it, because I know I trust Dr. Joseph, so I ain't too scared. It'll be good. I have a low pain tolerance. That was the only concern.
Botox you can't get done. I think you could probably technically do microneedling, but with pregnancy, they get like low blood pressure, right? So moving some blood probably is not a good idea while somebody already has low blood pressure. So you just kind of increase the risk for probably fainting in the office more than anything, just because of low blood pressure, and just to avoid any type of unnecessary complications.
Yeah. I'm glad it don't sound too scary. It's not too loud.
That's what you want to hear. You may feel
I
like
was
a
like,
real
I don't
life
really
person.
hear nothing. For real. It's not too bad. Well, maybe when it get by my ears, it'll be loud. But I can't feel my lips. Are they dry? My lips are for real.
It's literally the same thing, and both is just different manufacturers. So I guess one person is better than the other
Or
one.
maybe it just needed to sit longer.
What I'm gonna do is I'm gonna get it compounded at the pharmacy. And just get some extra strength in case you may.
I feel the difference. Because I feel this, but I don't feel it. You know? I feel it, but it's like,
You felt the other one coming off though,
Yeah.
the first one.
it's just like pressure. But
You know something moving, but you really
You're right.
do you have anybody else good too?
I'm not sure.
I'm gonna test the forehead first, okay?
Oh, I don't feel nothing.
Okay. That's okay.
That's real good. I can't even feel it for real.
Let's do a layer of the PRP. Kind of do the forehead first.
It was the same thing ever.
That wasn't?
Mm-mm.
You feel it up here?
You tricked me. It's good though. It ain't too bad.
There we go. You're gonna see a small hole with a little bit of heme, a little bit of blood coming from there. That's just the areas that we cover with the PRP afterwards. So it's the series of needles going up and down in the pen and going over her skin right now to make those small holes where that PRP is gonna go. Then Aisha, if you could just go back over there.
The same area?
You okay?
Some areas are number than others, but I'm good. I'm a G.
You did good with
So far, pain level, I would put like at a 5.
that.
Some areas it's like 2, and then some areas it's a 5.
A little more than others. Might turn to your left.
You got it. Yeah, I don't feel that at all.
You okay right here?
Can't even feel it. My chin is bad too. Got a lot of hyperpigmentation.
It's hurting on the chin.
No, I was just saying that's why I got a lot of dots. No, this is a 0 pain. I don't feel nothing. Just like the pressure, like the vibration, but it don't hurt at all.
So what areas felt worse on this side?
Just the top, the very top of my forehead. Just like by the hairline almost. That was it. But it's unbearable.
Can you lift your chin up for me?
I was trying to tuck my lip to help you, but I can't feel it.
Yeah, as long as it's not pain.
Literally don't feel nothing. Like 0 pain. Literally it don't hurt. I don't feel nothing.
Feeling this over here on.
It's not too bad. Am I breathing a lot?
A little bit on the chin, on the right side. Not really too bad. One more light pass and we out there. Okay.
So if I have to change my pain level,
1
it
out of
doesn't
10.
hurt at all.
We got you at first though.
There's a couple areas where it's the numbing, just like around here, like close to my hairline. That was like a 3. But other than that, I really couldn't feel anything. Easy. So this is the less needles.
This is the best needles right here.
5, 6.
You don't feel this side, do you? You feel like strain your lip a lot. You feel like you strain your lip?
I'm straightening it now.
Or do you feel like you strain it? Like just
Yes, I do.
Try to get rid of this line right there. Try to move it toward me. We got a little bit more PRP. All done.
See.
Did it.
Right, smile.
Being so patient.
Yes, thank you. I did have one more question for you.
Absolutely.
So for we talked about the cleanser already. Can I resume my workouts as normal?
So I would refrain from anything today, tomorrow, just because your pores are open. You start sweating, do anything like that, you're gonna clog everything up, right?
Okay.
So just relax today. Morning time, I would go ahead and wash my face. Use your normal routine, whatever it is, a cleanser, refrain from any exfoliants. If you have any pain, I would do Tylenol. Stay away from like ibuprofen, that can actually increase bleeding. Tylenol over the counter, probably every 6 hours should be good for it.
So I can go to walk in the morning, just nothing too crazy. And then Wednesday I can resume regular workouts.
No SPF and all your good stuff too.
Tomorrow.
I would do it probably Wednesday. This is refrain from anything.
Sounds good.
Thank you.
Sure. How do you rate your experience?
My experience was a 10 out of 10. I felt very comfortable. I thought I was gonna be nervous, but it wasn't bad at all. My face is still numb right now, so I can't feel my face, but
Sure. How does it feel, the pain level?
right now, there's no pain right now. It's like a little bit of stinging and tightness from the numbing, but I don't feel anything right now.
All right, so we just wrapped up the day. Today we did some PRP with microneedling. It was a good overall experience. Patient was taken care of. We did that to treat some different changes in the skin. So we got the skin texture better. We got more even tone skin from this procedure. And I'm excited to see her results. In a few weeks, I'm gonna have her come back and we'll do another picture and talk to her from there. But this was another procedure that we added to the day. We added to the overall procedure log. So I've done over 500 cosmetic procedures, both surgical and non-surgical. So this is another one to the belt. Again, more reps. Ultimately, you get better. And then I'm just looking for the best results. So the more shots that we put up, the more we gonna master this craft. So just trying to take over the whole entire field of aesthetics, and this is part of it. So we're gonna keep it going, man. One more down in the notch. So let's keep it going.